Catherine Macaulay, who founded the Sisters of Mercy in Ireland in 1831. She said, when I was creating, imagining, I didn't know where it was all going. I only knew the passion to respond to the cries of the powerless. Today, we really don't know where it's all going, but we still have that passion. We allocate our resources to heal, to be advocates for the poor and the disenfranchised, and we do that in partnership with others. So we need to do the kinds of things that continue to ignite that passion.
The Sisters of Mercy set the foundation for who we are today and who we will be tomorrow. We're going to be much more focused on wellness, taking care of our communities and keeping them as well as possible, and caring for them in settings that are much more comfortable for the patients and keeping them out of the sterile environment of a hospital. But having the technology and the facilities that are state-of-the-art, so if you do need acute care services, we're able to deliver all of that.
All of the survivors who have been here in this clinic, they feel appreciated. They feel like they've been treated with dignity and respect.
So we established a medical safe haven for human trafficking victims and survivors within our residency clinic, and have trained everybody within the clinic from the front desk staff through the medical assistants and nurses on human trafficking and victim-centered trauma-informed care. We ended up collaborating with all the different players in the community, from CPS to law enforcement to multiple community organizations that provide safe housing, case management, social services for human trafficking victims.
Well, I was actually in a homeless situation, and I had been in and out of the hospital a lot.
Dignity and its employees have to deal with health care. We have to deal with housing, but together we deal with the human being.
The biggest challenge in any community is taking those programs to a community-wide scale. So as we are able to scale up and make these programs larger and community-wide, yes, there's hope, because the programs work.
I deal with patients who have bipolar, schizophrenia, a lot of depression, a lot of anxiety. One of the huge issues that I see with patients is homelessness.
The data underscores that a large number of our citizens who are homeless have comorbid psychiatric issues and substance abuse issues. And this program brings together the support, the substance abuse treatment, the behavioral health treatment, all together under the auspices of navigation to wellness.
When you look at our region and the level of collaboration that exists here, the kind of facilities and people and specialties that we have, it is really a rare thing.
From a corporate and civic standpoint, you'll find our healthcare system leaders on critical boards. You'll see their rank and file teams as volunteers. So in addition to driving the economy, they're very much the backbone of the civic fabric of the community.
We have a number of competitive healthcare systems, but they all work together to try to address some of the many healthcare related issues that have faced the region, including mental health, including emergency room accessibility. So they have all worked together, and Dignity Health has taken a lead in all of those initiatives.
Prior to using the Augmetics and Google Glass to now, I used to have to sit in the office and take notes while I visited with the patient so that I could remember and put that information into the chart. The only difference is that now there's somebody listening and sometimes watching, but most of the time just listening to the interaction with the patients. You have to be able to be moving forward and keeping up with technology and keeping up with medicine in order to give the best, highest quality care.
current patients that we are treating are patients with asthma that can be triggered from a variety of factors, so allergies, smoke from environmental air pollution, viruses and infections. The device is a sensor that basically attaches to current inhalers, and it basically just records the use of the medication. We've been able to demonstrate an effectiveness in reducing high-cost healthcare. Emergency room visits, hospitalizations have decreased. We can actually go in and look when they used it, how often they're using it, are they compliant or adherent to treatment, and then adjust the medicines accordingly.
Partnerships with the entrepreneurial community, the venture community, large technologies are so critical for us to be able to succeed. Now, they are not the hands and the hearts and the humanity of care that we deliver every day, but they allow us to deliver that care in new settings, in new ways, in targeted manners, and ultimately allow us to better serve communities than we would be able to do on our own.
We're very much on the forefront of trying to make sure everyone's treated with kindness and with excellent medical care.
We are known for multiple centers of excellence and service lines. I think one of the values of the health system has always been excellence and a focus on excellence and attracting physicians in particular who are focused on excellence.
We are a very robust part of this economy. 2018 is a very important year for Dignity Health because we're in the final stages of our alignment strategy between CHI and Dignity. That's why I think we're such important partners to the community, to our politicians, to all the constituents in Sacramento. So it puts us in a very good position to make a difference for the lives of our communities.